Hey everyone, this is Beth Winkler. I'm a physical therapist and owner of Magnolia Physical Therapy. I wanted to send out some exercise for those of you who are having some low back pain and you're home quarantined and can't get to your physical therapist or get to your doctor for help. I already posted phase 1 of low back exercises, so this is our phase 2. So this is, you're not having too much pain, but still feeling limited and having a hard time moving your spine around. So the first one I want to show you is called the bridge. So you're going to lie on your back with your knees bent up. Again, try to maintain that neutral spine as much as possible. The neutral spine, just as a review, is if you're you want to arch your back as much as you can comfortably, and then flatten it as much as you can comfortably. And the neutral spine is somewhere right in the middle there where you feel you can comfortably stay. And then pull in the abdominal muscles a little bit just to help stabilize there. So this is called the bridge. And what you're going to do is keep your pelvis stable, and then you're just going to lift your hips up and then bring it back down. This works all the muscles in your lower back, all the little stabilizing muscles in your spine. So we're going to do about 2 sets of 15 of those. Again, if any of this is painful, you can modify it. You could just go up a half a bridge and come back down. Okay, the next one is cat camel or cat cow, depending on how you want to label it. This is more for mobility. You're going to come into quadruped position or on all fours, and you're going to pull your abdominal muscles up and in, like you're stretching there, and then come back and reverse the opposite direction. Try to get your neck in the movement as well, so you can get that whole spine moving. Gonna arch and then flex. Again, doing about 2 sets of 15 of each of those. And then while you're in this quadruped position, what you can do is, again, find that neutral spine, pull the abdominal muscles up and in. Remember, we talked about that string pulling up the small of your back. Imagine that string is pulling up and you're pulling your belly button up to it. Okay, so holding that stable, you're gonna lift opposite arm here. So make sure your neck is in a neutral position. You don't want it extended or flexed. And then lift up, and then back down, and then lift up. Every time you lift up a limb, the opposite stabilizing muscles have to kick in. And then if you're feeling pretty good about this, you can add in the legs as well. So remember to keep that spine stable and extend out. If you feel that you're wobbly like this, it's probably a little bit too advanced for you at this moment. Imagine if you had a bat or a pole lined up across the small of your back. You don't want it to tilt at all. And extend. And again, 2 sets of 15 of these. So hopefully that was helpful. We are offering telephysical therapy visits. Your first one is free, so if you want to give us a call at 504-733-0254, or you can also email me if you have any questions about the exercises. I'm happy to go into a little more detail. BethW@magnoliatherapyla.com. All right, stay pain-free.